see that much death and not come out changed.
Grim words from a nurse who has been battling COVID for months. Days away from our second COVID Christmas, the nation is facing an uphill battle as the Omicron variant spreads. Just like last year, hospitals are struggling. Burnout and staffing shortages are pushing many to look for traveling nurses, healthcare workers that move around the country, filling in the gaps. TV5's Trevor Sahaki spoke to one of these nurses on the front lines of the fight.
When hospitals are under siege from COVID, they bring in the cavalry, traveling nurses.
I've now done 16 contracts, and before that I was a staff nurse for several years. So you get a shorter orientation period, and you're expected to basically hit the ground running, which right now is so important to be able to just start helping.
LYDIA Mobley is a traveling nurse currently in Traverse City. Before then, Southfield, Cadillac, all the way to California, and back to Lansing. Traveling healthcare workers typically sign on to 6 to 10-week contracts at various hospitals around the country.
It's been really disheartening to see that Michigan is currently one of the worst states, because I have friends, at most of the hospitals because I've worked there in the past.
Though traveling nurses don't get benefits from the hospitals they work at, the pay can be triple or even quadruple what a staff nurse makes.
Those nurses were so grateful that somebody was there because they had been dealing with this since the start. Again, that was in Lansing, and that was the warmest welcome I've ever received as a travel nurse.
But the front lines aren't pretty.
Recently on my contract, I was assaulted by, he was 6 foot tall and 225 pounds, and felt it was okay to punch me in the ribs, simply because I had asked him to stop pulling his IV.
Well, unfortunately, the assaults are nothing new. Mobley said COVID appears to be making things worse. And on top of all that, people keep dying.
We'd have 3 deaths in just the first 4 hours of the shift, and you can't see that much death and not come out changed.
Mobley said there's even local traveling nurses now that really just work at one hospital. She encourages any healthcare worker to check it out. Trevor Sahaki, WNEM, TV5.
And the CDC is predicting record high new infections nationwide as soon as January because of the holidays.